I'm actually just going to lift this up so the camera can see it better. So we got petechiae right in that lat and infraspinatus region, which was one of the rotator cuff muscles that we were experiencing pain with, and then also throughout the lat for the restriction. So that's definitely. Hey, Alina.
Hi there.
Thanks for coming in today. Alina'a is a second-year CMCC or chiropractic student, same school that I went to, and she's been in shadowing recently and has volunteered to be in a video herself, so very appreciative of that. I'm going to let her kind of take us through a little bit about herself and the complaints and injuries she's had in the past, and we'll just see where we go. So, Alina.
All right. So yeah, I'm really happy that you had me here today. So in the past, I had a left shoulder injury, and it's kind of been bothering me since I was around 16. It's a lot better now compared to before, but I feel like I still have like limited range of motion. It does act up sometimes. And then I'm a student, so I always have a stiff, tight neck. Something like obviously you can't really control sometimes. I try to do some stretches on my own and kind of release it, but it tends to always kind of be stiff. And with that, my mid-back also tends to be really stiff.
Yeah, okay.
I try, to like...
A lot of those, like, studying-related related problems. So I actually made a video about the CMCC curriculum and just how intensive it can be. I'll link it up in the corner, so if you want to watch it, there it is. But what was it it's pretty self-explanatory what happened to the neck and the upper back. A lot of time sitting at your desk, your computer, reading through your notes. But the shoulder injury, what happened there?
Honestly, there was no specific incident. It just kind of came on, just was hurting.
Okay. Well, were you an athlete? Like you played overhead sports? Or?
Yeah, so I grew up playing soccer and hockey, and then I got into the gym pretty young as well, so I was always pretty active. Okay. I think it was probably a combination of like bad form,
overuse. Did you play contact hockey by chance?
Yeah.
Yeah. Okay. So maybe you got hit the wrong way. We're not really sure where it came from, but we just know that it was definitely bothering her once upon a time. Still bothering her a bit, but it's much improved. So, all right. Anything kind of with the low back, or I know you mentioned the ankle beforehand as well.
Yeah. So just moving down, more recent complaint on my left lower back. It's actually been hurting quite a bit. Okay. And it gets more aggravated when I walk for extended period of time.
So a lot of walking does it for you.
Yeah. Like I just got back from a trip, and it was primarily walking every day, and sometimes it would just be killing me.
Yeah. Okay. All right. Yeah. That's pretty common. It sounds like it might be an SI complaint, but we'll go in there, we'll confirm it ourselves. And then the ankle too, because you did mention that off camera.
Yeah. Last summer, so almost a year ago, I had an ankle sprain on my right.
Okay. And how long did that last for?
I was probably limping around for a few months.
A few months? Yeah. Okay, that's a pretty serious sprain then.
Yeah, it was pretty bad.
When most people sprain their ankles, you can expect pretty big progress within the first like 2 to 3 weeks, but if we're limping around for a few months, we're looking at more of a tear than a sprain, or potentially a high ankle sprain, which is a completely different structure entirely. Did you ever get a diagnosis? Or?
I didn't end up seeing anyone.
No,
for
okay,
it,
you just limped right through it.
Yeah, it was just a busy time.
Fair
and
enough.
School was starting.
And then it's fine now, though. You feel largely stable now. Okay, then if that's resolved, then it's nothing to really be too concerned about. Okay, so for today, what we'll do is we'll get into a physical exam. Okay, I will check out the range of motion of the neck, the upper back, the shoulder, because you said you feel like you have less range of motion on that left side. It was?
Yeah, left
side. And we'll take a look at that SI then. Do you have any questions about that whatsoever? Or?
No.
No. All right, then I'm going to get you to bring your chin down to your chest for me. And does that recreate any of the usual stiffness you were saying you get back here? Yes or no?
Yes.
Yeah. Okay. So when I go ahead and push further, better, worse, or the same?
A little worse.
A little worse, okay. And to confirm, that's down both sides or just one side?
Both sides.
Both sides. Okay, I'll get you to come back up. Look up towards the ceiling for me, please. Anything kind of in the back of the neck, shoulder region at all?
No.
No? Okay, we're going to go ahead. Oh, same deal. We're going to do a little bit of passive range of motion. How's that? Or passive overpressure, excuse me. That's okay still? Good. Face forward. Get you to rotate your head, check your blind spot as far as you'll go. She's getting to about 80 degrees, which is pretty good. I'm going to go ahead and go a little further. No, we're pretty locked at 80 degrees. It's not going any further than that. I'll get you to rotate this way. On this side, we've got maybe 60 degrees. Okay, so about a 20-degree difference. Let's go ahead and move it this way. And we can turn it to about 65. Okay, so face forward, ear down to shoulder. Tightness, yes or no?
Pretty tight, yeah.
Pretty tight this side?
Yes.
Okay, and ear to shoulder. Same deal?
Same thing.
Actually feels a little bit tighter on this side, or maybe I make that up, I'm not sure. Okay, so you also mentioned that the shoulders are kind of uncomfortable for you. So the left one, pain? Restriction? Well, I can't remember what it was you were describing.
Both.
Both, okay.
Yeah.
So to start, I want you to bring your thumb up for me. Give me a straight thumb and keep your arm there. Don't let me move it. Good. Thumb down. Keep it there. Don't let me move it. Any discomfort with either of those?
That
movements?
one hurts.
That one hurts. Yeah. Okay. So bring the arm back. Keep it here. Don't let me move it. Okay. Fight, 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 fight. That's okay.
A little bit of pain there.
Okay. Fight, 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 fight. That's okay.
That's all right.
That's all right. All right. Hand behind back. And I want you to lift the hand off the back towards the wall. That's okay?
Yeah, that's okay.
Got it. Okay. And just to confirm, let's compare that to this side. Thumbs up. Fight, fight, fight. Good. Thumbs down. Fight, fight, fight. That's okay?
Yeah, that's okay.
All right. Come on back here. And fight, 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 fight. It's okay?
Yeah.
And one more. Good. Okay. So last thing, I want you to actually just bring your arms straight up to your sides, as high as they will go. As high as they'll go. Bring them up, 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 up. Okay. So it looks like you're actually having a little bit of trouble getting this one up a little bit. Oh, there we go. Okay, so if you fight it, you can get it. But like unconsciously, you are having a bit of a restriction there. So I'll do a lat test. A couple of things going on with the shoulder right now. Number one, she's testing positive or showing a little bit of discomfort when we're testing her supraspinatus tendon, as well as it was external rotation, so your infraspinatus. I'll throw both those pictures up so that you guys can see it now. The fact that when she's bringing her arms all the way up, she actually unconsciously gets a little bit restricted on this side, just making me suspect a potential lat restriction. So we'll test that with her laying face up, as we usually do. Either way, those both look like something that we can take care of today. Next up, we're going to be looking kind of at the upper back region and the low back, so I'll get you to start by laying on your back, please. First thing we're going to do, you'd be familiar with this as a CMCC student, is the classic straight leg raise, very broad screening tool. We'll start, it was the left SI you said that was bothering you?
Yes.
Yes, okay, and that is your left side again. So we'll actually start with your right, just to see what normal looks like. We're going to bring this all the way up. And any discomfort in the back with this?
No, just tight hamstrings.
Yeah, I can definitely feel that there. We're at about 80 degrees, which I consider a pass, so well done there. Bring that back down. Now let's go ahead with this side over here. Gonna bring this leg straight up. Any discomfort with that?
No, it's okay.
No,
It's the same hamstring
Same
tightness.
hamstring tightness, okay. So that's okay. We're going to switch over to a thigh thrust. So the straight leg raise really is looking for more radiculopathies, which is the fancy way for saying disc herniations, which I don't think she has, but we're still going to do it anyways, just to be thorough. Next, let's get into the thigh thrust. So this is a test that tests for the actual SI joints. There's lots of them. Sometimes it's negative, they still have an SI problem. Sometimes it's positive, they don't. But still, that's why I have to do multiple tests. You can't rely on just one. All right, so hand is behind the SI here. This is your right side. Wow, that just went.
Very tight.
Okay, all right. So, okay, I've never actually had somebody release that quickly on a test with an SI. I don't know if I'm impressed with you or me. Why not both? All right, so let's go ahead and do that on this side. So this is the symptomatic side. Any discomfort with that movement there?
Yeah, this one has a little pinching.
That one's got pinching. Okay, so it's interesting that you release so easily on this side. This side is a lot tighter and you're getting that pinching. That kind of makes sense to me. So left shoulder, we're going to start with your right. So what we're going to do here is we're actually just going to bring this all the way up as far as it'll go. And Alina'a is able to actually get past the table here. So she's able to get past 180 degrees when we're doing this, which is a good sign. Let's go ahead and rotate as well. So in rotating out like that, or inward, excuse me, we are challenging the lat, we're activating it, and she's still able to get there. So she's got full lat flexibility on her right side. Let's compare that to her other side over here. So bringing this all the way up. And okay, so we're not even rotated out yet, and we're already stuck at about maybe 170 versus getting past 180 here. So let's go ahead, rotate in. And that's about the same at 170. So I think it's pretty safe to say that Alina'a does have a bit of lat restriction involvement on this side. We're going to be able to take care of that, stay with the usual sports massage stuff that you guys are probably used to by now. Now I'll get you to go on your front. Okay, so my hands are coming in on your back now, okay?
Okay.
All right. It's important to say you don't want to surprise the patient or scare them or whatever. So let's go ahead and just have a palpate through. We do have a lot of tightness up in the levator scapulae. I'll throw the muscle up there for you guys to see. but that's very, very common in your students and your corporate or desk job workers. You're going to get lots of tightness in the left scaps, as well as the upper traps, which, oh look, we got tightness with. So getting down into the thoracolumbar junction, where the thoracic spine or the mid-back becomes the lumbar spine or the lower back, we've got another good chunk of tightness. Now this is common anytime we're in a transition zone, whether it's the CT junction or the TL junction, because of the biomechanics moving in different ways. So that's going to create a lot of shearing force in those locations. Would you agree that you feel quite tight here? Because to me you do, but the patient might feel, okay, she feels that she's quite tight there as well. Even when I'm poking it, I can actually feel her tensing up under my fingers. Maybe she's super ticklish, maybe it's tender, who knows, but I'll be taking care of that for her today as well. Let's get down to the lumbars, and that's quite rigid on both sides. Yeah, you weren't kidding. Okay, SI joint, sacrum is the bottom of our spine, ilium is our hip bone proper. SI joint connects those two things, so left side and right side. Well, your right side actually feels pretty good, maybe because it literally just went the other take, but left side definitely feeling kind of restricted. Getting into the glute region here, so the glute meads. To me, they feel tighter on the tighter on the left there, and piriformis off the sacrum over to the greater trochanter. That one actually feels a little bit tighter on the right side, strangely enough, but okay. Oh, freebie. My hand's going to go on your front hip here, okay? Just like that. Hand on front hip, good. So Alina's definitely got some tension up throughout the thoracic region. Couple that with the fact that she appears to be quite strong. She does resistance train quite regularly. She's also a spin coach on YouTube, fun facts. But we're going to try to get through that, see if we can get some motion to the joints, and then follow that up with some muscle work. So starting off with our mobilizations, good old osteopathic stuff. Alright, so first time you adjust a new body, you always start light. Okay, you can always add more force afterwards. You can't take force away. So Alina, because I never adjusted her before, I'm going to start by hitting her light. And if that doesn't go, then we're going to try it again. We're going to hit her a bit harder, okay? So does that sound good, Alina?
Yes.
Perfect, okay. So I get you to take a breath in and all the way out. Okay, so nothing there. We're going to use a little bit more force this time around. In and all the way out. There we go. We'll do one other one here, in and all the way out. Good. There we go. So now we're up into that left scap area we were talking about before. There's two ways to get the CT junction done. One way, there's no way to know which way will go better until you just go and try for the patient. So we'll try one. If it doesn't go, we'll try the other. So what I'm going to do is I'm going to take my contact, Alina, and And I'm going to get you to take a big breath in, a big breath out. And as you do that, I'm going to turn your head to the side, and you're going to let me turn your head, okay?
Okay.
All right, so breath in, and all the way out, all the way out. Good. Good. So I talked during that like an idiot, but that released quite well. Let's get the other side. All right, again, breath in, and all the way out. Once again, another release, but a subtle one. Okay, good. So that was the thoracic spine, the CT junction. I'll actually let you choose what you want treated next. You want your low back or do you want your neck?
Let's do my neck.
Let's do neck? All right, sounds good. I'll get you on your back, please. First things first, we're going to have a feel through Alina's neck here. And we got some moderate stiffness kind of throughout. To me, it's actually feeling like both sides at the very top, so that occiput that we're starting to become pretty familiar with. I'll still put a picture up there for you guys. And then throughout, all the way down the right side. So, MRT. I feel like I might be pulling your hair there. Is that okay, Alina?
No pulling.
No pulling? Oh, I love it. Okay. Alright, so Alina, you've had your neck adjusted before, yes?
Yes.
Perfect. So, similar concept, multiple ways to adjust a neck. Not really sure which way goes best for each person until you just try. So, we'll start with a rotary near the top then. So I'll get you to turn your head as far as you can to the left for me, please. Good, and then I want you to try to, you see this muscle right here? I want you to try to turn that off by dropping your head into my hands. Good, okay, good. There's one right at the very top. Look at that. So, and that already feels a lot better from just there. So much so that now the bottom side feels worse, but it's actually the same just because this feels so much better though, so. Looking back to the left side. I'm going to bring the microphone over. And I'm going to get your head to turn as far to the right as you can. Good, and same deal, I want you to turn that off. Good. A lot more on that side. Whew. we're actually just going to try the right side one more time to see if there's anything lower down there for you. And if there isn't, that's fine, but hey, at least we tried. Completionist, right? Turn as far as you can to the left for me, please. Good. Same deal, drop that head. Good. One more there. Okay. How were those?
That felt really good.
Happy to hear. I've yet to hear somebody go, that was absolutely terrible. Position. Here's what we're going to do. I'm going to change the arms up just a bit. Good. I'm going to get you to slide closer to me. Thank you. Hips too. Thank you. Awesome. So, that side. Get you to take a breath in for me, please. And all the way out. Yeah, that went just as well as the other one unintentionally did. I'll get you on the other side. For this, I'm actually just going to take this. We're going to pull you a little bit more. Awesome. Like how you're essentially in the correct position. It shows me that you've learned it. Get your hips a little closer. Good. Leg straight. Awesome. Okay. So, breath in. And all the way out. Yeah, there was still some left. You're correct. All right. Now, I think actually I took quite a high contact there on the lumbar spine, so much so that I actually felt it go higher as well when we were adjusting into that TL junction. Now, usually when we're trying to get that transition zone, we're going to do something called a Banyan adjustment, which I don't think we're actually going to have to do after that one. But you know what? Let's just be completion. We'll try it anyways. I'll just put this hand in your armpit for me. Good, good. And I'm going to snake in like so. And just like that. So what I want you to do, Alina, is I want you to have you done a Banyan before?
I have not.
No, okay. So the gist of this is that I'm going to get you in position. Then I'm going to get you to use this arm to pull my arm further up towards your head. Okay, so practice that right now. Good, just like that. Okay, so relax. And when I say, I want you to do that movement, okay? Go ahead. Nope, looks like we already got it. So we tried. Okay, so tools are coming in on your back now, okay? We'll start with the lower back here. And just while we get started, it's become pretty habit that every time I'm doing this with a patient, I ask them a question. So my question for you, Alina, is going to be, what is it about your job that you find most rewarding? And I don't know if I've mentioned it yet, but Alina is a spin coach on YouTube, so I think that's probably going to be the context here. So do you have an answer for that?
Yeah, so in terms of like why I became a spin coach on YouTube in the first place was because with school, sometimes it's really hard to commit to teaching a class in person every single week, but it still allows me to, you know, do my passion. And I didn't realize when I started how many people I would be reaching and positively impacting literally their life. Obviously, for that amount of time they're on the bike, but then also I've gotten these great messages from people where they're telling me, like, I've increased their confidence to, like, try new things, to, you know, just, like, live their best life, essentially. And I think that's the most rewarding part, just seeing the impact I'm having on others. And I didn't even realize I would have that impact when I started. I just wanted a platform where I could, you know, scream at people and listen to live music and move to the beat.
So that's awesome to hear. Exercise is, without a doubt, probably one of the best things that any individual can do for themselves. And it's great because once you do get the exercise going, you'll find that you'll benefit in so many other life ways as well, not strictly just limited to the physical benefits too, but also the mental and the emotional ones. And if you're in a better mental and a better emotional place, that's going to encourage you to go out, do other things that are eventually going to promote a healthier life. So yeah, absolutely. What you're doing is affecting people way more than just getting their heart rate up, Alina, and you should be very proud. How long ago did you start that?
I started it over the pandemic, so
Okay.
about 2 years ago now.
Okay. All right, 2 years you've been working on this little project, and you've been getting these fantastic messages. So happy that it's something that you get reward from, because believe me, it's something that all of them would be getting reward from as well.
Oh, yeah.
I'll go ahead and throw her link in my description too. So this is our first collab, I guess. How does this feel, by the way?
It feels good.
Good. intense?
Yeah, that would.
That's about right there, eh? Yeah, okay. You need me to back off? Because that is pretty tender.
Oh, no.
No? Okay. Want to make an omelet, gotta break some eggs, right?
That side does not hurt as much.
Hurt nearly as much, eh? Interesting. It's all that left. Oh, did we find a spot?
Yes.
There we go. I had to go looking.
Too soon.
Yeah. So Alina's noticing significantly more tenderness as soon as we get between the scapulae there, which is pretty fitting for a student dealing with upper cross syndrome, which is kind of what we've been alluding to this whole time. Also known as student syndrome or corporate syndrome. It's a result of sitting too long and leaning in that forward classic techie laptop or reading posture. So this is a postural complaint. It's nothing serious. It can be resolved with a little bit of lifestyle modification and perhaps some targeted strengthening too. Although Alina'a, as I've said before, is quite strong, so my assumption is it's going to be more of a postural and lifestyle modification thing. Basically, stop studying so much, okay? Knock that off. Just ask the internet. We're not even real doctors, okay? Don't even worry about it. Alright, now to get at that lat restriction, I'm actually going to need you to lay on your side facing the Christmas. Actually, let me work on this a little bit longer, but you're going to lay on your side facing the Christmas lights that never go on in like maybe 30 seconds, okay?
Alright, sounds good.
So Alina'a has started to get that petechiae up here. It is a little bit harder to see on darker skin, but we can see it right there. It's starting to arise in that lev scap area. Okay, let's get you on your side facing Christmas lights. And I'll bring this right up for your head. There you go. Okay. So, can we still see everything? Yeah, we can. So I'm going to rotate this a little bit. What I need from you, it is your left shoulder, is to actually bring this arm and kind of hang it over your head, okay? So like just let it, yeah, perfect. So that opens up the lat. Okay, I'm just gonna move this a little bit more. Perfect. Oh, wrong way, my bad. Nope, that was the right way. And bend you just a little bit more as well. Yay for editing. Okay, and sit tight like that for a bit. This is too intense. Suck it up. You're getting a little bit of the petechiae here as well on her, which is right in the belly of that lat, so that I find quite unsurprising given the restriction. that's very noticeable. Santina, can you see that? Like, yeah. Ooh, yeah. So I'm actually just going to lift this up so the camera can see it better. So we got petechiae right in that lat and infraspinatus region, which was one of the rotator cuff muscles that we were experiencing pain with, and then also throughout the lat for the restriction. So that's definitely, looks like we've addressed it. Sorry, I got a little bit of the gel on you there. I'll go ahead and get the extra off you now. Actually, I'll use my hands first for a minute. Alright, so we just finished the scraping as well as the neck and all the adjusting for Alina'a here. I'm going to have you go ahead, and the first thing is I'm going to get you to bring your arms all the way straight up once again, as far as they'll go, And look at that. Okay, so her left arm came all the way up. It's actually going even further than her right arm now, her shoulder. So that very much tells me that we were having a lat restriction on the side. That's been cleared up for now. You can bring them back down. And also, let's get you to rotate your head to the left for me as far as you will go. Beforehand, we were at 60. Now we're at about 70. So a little bit of improvement, a little less than I would have liked. So we probably want to do a little bit more work in there. Maybe even use the soft tissue tools up within her neck too next time. But like definitely, I know the shoulder restriction was a concern of hers. We addressed that very well, so I'm happy with what we have there. I'll get you to throw your shirt back on and face down, okay? Still tender around that TL junction, eh? That's going to take a few. I always get such interesting reactions when I use these on patients. Some people find it ticklish, others it makes their nose itch. Some people cough or sneeze, which is actually a little bit understandable if we're percussing the lung field. And then also, like, it will reveal remaining spots of tenderness, such as usually, again, those transition zones. The SI region. Alina'a, we're all done now. So how did you find all of that to be?
I enjoyed that. Like, some of the treatment did feel pretty intense to me, but now I feel like my shoulder range of motion has increased. Like, my full back feels less stiff.
Okay, good. Yeah. So have you ever experienced something like that before that was quite that intense, or not really?
I have not.
That's totally fair. So there's different modalities to every individual field of therapeutic practice. And I know that's kind of a loaded sentence to say, but when I say that, it's like there's different ways of applying chiropractic. Okay, there's Nuka, there's Thompson, there's Gonstead, there's evidence-based, there's subluxation theory, there's diversified, there's like 6 different, probably more ways of practicing this. And then same deal with massage, right? There's your relaxation massage, there's your sports massage, there's your deep tissue, yada, yada, yada. These are all just kind of fancy terms to describe little differences between the two, but with me, as a diversified chiropractor, I do a lot of what I call sports massage, which again, just an umbrella term. The analogy with sports massage is that you're treating an injury or you're treating an athlete for that problem specifically versus just a strict relaxation massage. So yeah, sometimes that is a little bit more painful, sometimes that is a little bit more intense. But I think Alina would agree, and I know that the majority of my patients would agree, that that more intensive approach, you get a lot better results from it versus just 60 minutes of like a little rub down, which might feel better afterwards, but you're still going to have that same problem. Now that being said, without consistent input, we don't get consistent output, so this is something that would probably require maintenance, if not a full like lat flexibility program. Off camera, I'll probably show her some eccentric pull downs afterwards, which can really help to free up the lat prior to a workout, as well as foam rolling. So those would be 2 options to consider here. But yeah, no, what she's saying isn't unusual. I wish it wasn't as intense, but hey, if you want to make an omelet, you got to crack eggs, right? So yeah. Thanks for coming in today. Any other closing thoughts? Or
No, I'm excited to see where I'll be in a few months after consistent treatment.
Good. Excited for it. All right, Alina. We'll end on a high five, as I always do.
Don't forget to give this video a like, comment, and subscribe.
Thank you, Alina.